All right, it's 4:01, so I'd like to call our Wednesday, February 18th Board of Health meeting to order. I'll seek approval of our agenda for today.
I'll make a motion to approve the agenda.
I support that motion.
All those in favor?
Aye.
We'll move on to the approval of the minutes from our meeting on January 21st.
If there are no additions or corrections, I move they be accepted and submitted.
Do I have a second?
Yes, you do.
All right, all those in favor, say aye.
Aye.
All right, we'll move on to reports. The accounts payable report.
Good afternoon. Are there any questions? It's a small one for this month.
I just had a question on page 1. The data logger.
So that was, for our vaccine refrigeration units, we have to have a data logger. So it monitors the temperature for 24-hour periods. We have to replace them periodically because obviously they get old, they get bad, they no longer maintain the correct temperatures. So happened to be the beginning of the year, so we replaced them.
And then on the third page, about a third of the way down, Seabright Products for equipment repair.
That is for, the recycle center here in Adrian. There's several of the machines have been having some issues. And probably elaborate on that.
So this one, I believe, is for actually a maintenance visit that they came and did what is supposed to be the annual maintenance on it. They then sent us a laundry list of other things that need to be fixed that we're in the process of working on, basically making sure that the finances are all in place for us to get those taken care of. So this was just a come check on them visit, and there will be probably some additional bills to come, just that because there are some additional repairs that will need to be made.
Okay. Any other questions from the board? Hearing none, I'll seek a motion to approve the accounts payable report.
And accept the financial report. Accounts payable.
I second.
All right, all those in favor? Aye.
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 All right, we'll move on to our health officer's report.
Good afternoon. An update on some respiratory illnesses in the county. Influenza, COVID, and RSV are at a moderate level of transmission. And the RSV is increasing a little bit, and COVID seems to be decreasing just a bit. As of yesterday, when I ran summary reports, those that are seeking acute respiratory illness healthcare has been increasing overall. Adults are seeing the largest increase. They represent 76% of all healthcare visits this past month, and youth represent 24%. RSV, I ran separate numbers for that. That is just about 1.5% of the overall visits, and 29% for adults, and 71% is youth. Gastrointestinal illnesses causing people to seek healthcare has been decreasing. There was a very large increase over the last couple of weeks, and that is on the downward track. Avian influenza, the last detection was January 28th in Ottawa County. There has been no detections in Lenawee. Measles cases still stand at 30 from 2025. I don't believe there's been any detections or any, shouldn't say detections, any diagnosis in 26. We have not had an update on the statewide septic code. I was on a meeting and they did say that they were going to introduce it, but we have yet to see that get introduced again. CDC infrastructure, we're at the very final stages, just waiting on some cabinets and a new window. for the clinic reception. So that should be coming here in the next few weeks. And also we received a notice of award for marijuana education again this year. And we shifted our strategy and our focus this year and are focusing on marijuana use during pregnancy. So it's exciting that we're shifting and focusing on a certain population. And so what we're going to do is provide education for those individuals that come and visit the department through the Great Start Collaborative. It's the prenatal and infant resource program passport program. And so individuals that need some assistance or just find out about resources, there's this little roadmap that all individuals go to, and they get a stamp that they have been there and they get educated. And so we're going to provide them with a little safe kit when they come to our department and just provide them some education about marijuana use during pregnancy. So it's a great opportunity to collaborate with the Great Start and expand that passport program. So that's exciting. We'll also be doing a mass education campaign and doing some direct mailers to those that are on Medicaid and also billboards. So we're excited about this new strategy. So if there's any questions, I'll entertain them.
One of the programs I listened to not long ago indicated that 50% of pregnant women were using marijuana.
Yeah, so we're going to be on a mission to educate them some.
50%.
If there are no other questions for our health officer, then we'll move on to existing business.
I do not have any.
All right, we'll move on to new business, the food service license, late fee changes for 2026.
I'm going to let Casey kick this off quick.
So in your packet, you have a couple pages that kind of go over this. There is a brief explanation on the first page. I'm just going to summarize it. Essentially, for as long as I've worked at the health department, which has been over 10 years now, we have always charged a flat late fee on our food service license renewals. So these are people who currently have a valid food license. They have to renew them every year by April 30th. If they don't get it postmarked or to our office by April 30th, then we have always charged a $200 late fee on top of their license fee. So I did some looking around at some other health departments, both of those that are similar to us in population served and those that are our neighboring counties, just to kind of see what they do. And it is much more common to implement more of a progressive schedule, not necessarily a flat fee. The issue that I had with the flat fee is that whether you're late by a day or you're late by 30 days, it's the same fee. So there's no incentive. Once you're late, people will just continue to hang on to them and not bring them in. So what I wanted to do was implement something that's a bit more progressive, but I didn't want to do too many steps, just because that gets confusing. What I also had found was that there are several that have an official grace period, for folks to, things happen. And so I wanted to kind of look at implementing one of those. And actually looking back at some of our older fee schedules, we used to have one. I'm not sure why we got rid of it, why that change was made, but we used to give people anywhere from like a week to 10 days, depending on, I think, how the days fell in the month. So what we're proposing to do with this is to implement a 2-week grace period. You have in your packet, what those dates would be this year. May 1st falls on a Friday, so I kind of wasn't going to count that week. So that's why it goes all the way through May 17th. And then after that, basically from the end of the grace period through the end of May, it would be a 50% increase of the local portion of the fee. The total fee they pay is made up actually of 3 fees. It's our local fee, the state fee, and the education fee. So it's only the local fee portion of that we would be doubling. You have another page in your packet that runs over basically what our license fees currently are and then how they would change, just depending on when they get them turned in to us. And then anything turned in on or after June 1st would be a doubling of that local fee. By law, we're allowed to at most double the license fees for late fees. So I will tell you, I did go back and look. The vast majority of the late fees that we have are usually submissions that come in within those first 2 weeks. It is very rare that we have anybody who ever gets to June. We do a lot of work, a lot of reminder emails, reminder phone calls. We try our best to let people know, and we also typically get these out a couple months ahead of time. Usually about the beginning of March is when they go out. So we do our best to try to get folks in and avoid the late fee. So generally, it's just trying to implement more of a progressive schedule, so that way if they are late, it still gives them some incentive to still try to get it in as soon as possible, so they're avoiding that higher fee. And in general, I went back and looked over the last probably 4 years, we only ever typically have about 8 late fees a year. So most people get them in on time. I don't foresee this being anything. It's not an attempt to try to collect more money. If anything, it's giving people kind of more options rather than just having the flat fee that starts right away on May 1st. So that's what we're looking at.
And on the administrative side, so, trying to figure out where these fees come from, a lot of times we have to provide the method of how we got to these fees, and we were unable to do that. And we're not sure where it originated from, so this is also an administrative efficiency situation as well, just so we're able to provide the methodology of the late fee. Is there any questions, concerns?
And so just so you know, so my plan as far as if you do approve this, so they're gonna get notified about it in several different ways. When their license renewal packets go out, we send those out every year. There's always a cover letter that I put together. I plan to basically have this be the main topic of that letter. I'll also be sending out an email. Pretty much all of our restaurants have an email. And then when we start doing our reminders, whether they be emails or calls, I'll also make sure that it goes out in those this year as well. So we're gonna try to really cover it, so that way people are very much aware that the late fee is changing, if you guys choose to approve it.
Okay. All right, I'll seek a motion to go ahead and approve the food service license renewal late fees amendment for 2026.
Since they are recommending it, it seems sensible for me to recommend that we approve their recommendation to change the late fee.
I'll second.
All those in favor?
Aye.
Aye.
I didn't say aye.
All right, well, there you go. Plow ahead.
And it's in timely fashion because it can go out in this year's letter, correct?
Yes.
All right, we'll move on to program reports. We'll start off with personal health.
So our clinic still remains steady. One thing that I wanted to update everybody about is since 2014, it's in the public health code that if parents or guardians choose not to vaccinate their children, they are required non-medical vaccines, non-medical exemption. They are required to come to us for education. The state has partnered with the University of Michigan Public Health, and they developed a software application it's a collaboration with all the health departments, and it's standardized through all of the state. Hopefully in March, we'll be able to implement. It's an online education portal where all the parents will be able to go in and do all the education. We'll get all the information in the background, and they're still required to come in to sign legally for this education, but it will cut down on 30 to 45-minute appointment times for all of these parents. On average, we do between 400 to 500 appointments per year for this program. So we're hopeful to have this up and running in March. And it's standardized. There's multiple health departments that are adopting this. And this year it is free, and we're anticipating it to be free, hopefully going forward. If not, we have a backup plan. It's a very nice program. I have gone through it. It just gives the risks and benefits and the education and leaves it up to the parent for their choice. Any questions for me? Thank you.
Is there any percentage of parents that change their minds?
There was a big study that was done through Livingston last year. And actually they found between 2018 and 2024, Livingston is a lot bigger county than we are. They had about 4 parents that changed their mind for in-person. And when they started this beta project in the beginning of last year, they had 15 parents that changed their mind with doing the online. Personally, I can verify that some of the appointments do get very hostile and feel that we have judgment when we absolutely do not. We are there to educate, and that is all that we do. There's no judgment when you come in for these appointments. So us personally, we've had maybe a handful within the last 5 years that I've been director that have changed their mind. So we're curious to see how this education will maybe change a couple of people's minds.
Thank you.
All right, we'll move on to environmental health.
Okay, so you have all of your reports. The only thing I really wanted to highlight is just we're seeing a little bit of a dip as far as the well and septic applications. Permits don't seem to be having, to be as down nearly as much with it being as cold as it was for a while. I'm not really surprised at this point in the year to see that. We tend to see things slow down depending on how the weather goes. So, something we'll just keep an eye on. Other than that, as I mentioned, we have food service licensing coming up. We are right now just waiting on the copies of the renewal paperwork that we have to get from the state, before we can send those out. Typically, we like to get those out the first week of March. Hopefully, we got some email correspondence the other day, so fingers crossed we'll see those here fairly soon. I'm working on, I think I mentioned last month, but working on renewing our grant for the beach monitoring. Looking to potentially maybe add a location to come see. I reached out to them to see if they'd be interested. I haven't heard back. I'm gonna reach out again. And maybe follow up on that. If not, at the very least, it will continue to be our 2 state park beaches that we've been monitoring for the last several years. And we just had Radon Action Month. I think it was pretty successful. We had quite a few people come in and get their kits. So if anybody missed out on that, they are still available in our office. They're just $10 now instead of being free in January. So other than that, I don't think I have anything unless anybody has any questions.
Did anyone discover radon on their property?
So we, I don't think we will have a lot of those results back as of yet. They're typically lag behind about a month. So we get copied on the results of any, Lenawee County kits, on a monthly basis. The state will send us those. So it's not unusual to find it, especially here in Lenawee County. The numbers are often higher across the whole kind of bottom of the lower peninsula. People tend to find higher amounts. So it's not unusual. We often recommend people retest if they get anything above a 4, which is pretty common. And then we can give them guidance after that if they continue to get high numbers on how to find a professional and maybe potentially get a system installed in their home to get their numbers lowered. Mhm.
All right, we'll move on to finance.
Okay, hello. So in your packet, I've had our first quarter report. You will see 2 programs that are grayed out, and I wanted to just kind of highlight those briefly. The HIV prevention program, we received our grant contract a little late for that one because of federal funding. So we did receive that, and they did already catch up on those payments, so we do have those funds now. And then the water non-community type 2, that is an Eagle grant, and they pay us based off of our expenses. So I will see that check typically about 2 to 3 months after the quarter end. So while they do say local dollars for those 2, specifically on those, well, type 2 is at a 0. There's no local dollars at this point because it is fully funded by Eagle. I'm just waiting on the payment from them. But everything else for first quarter looks pretty much in line with how we typically are for first quarter. We do have a positive revenue to our expenses. We have really taken the initiative to be more conscious of our spending over the last several years. So I think we're doing a fantastic job of being socially responsible for everything. Are there any questions on this report? I meant to say fiscally responsible. Apparently, I just can't think this late in the afternoon.
All right, thank you. Open it up for public comment.
Back to the counseling on the marijuana to the pregnant ladies. Do you receive any negative feedback on that program?
Natalie can speak. Oh, you mean for marijuana education?
Right.
Oh, no, we, it's been well received each year that we've done different, strategies and things like that. For the last few years, we've given out, over 1,000 lock bags to the community. I think we've done that 3 or 4 years in a row. And just provide education all the time. So yeah, it's well received. We do not receive any negative feedback for that.
With our packets that we hand out now, there is some information in the packets regarding different types of medication and drugs when you're pregnant, but this will be more of a focus. Moving forward with this grant approval and the work plan that Monica's done. And the majority of the women are very grateful for the education. Not that, I mean, social media, or they could Google it or whatever, but they seem to really respond to when they come into the office and a nurse sits down and is going over the whole packet with them. It's very receptive.
Okay, thanks.
Anything from the county? All right. That so being, I'll look for a motion to adjourn.
Support.
All those in favor?
Aye.
Aye.
All right.